you can anticipate what they're gonna need if something's
Right.
not there,
Exactly.
rather than going, what's that?
So, yeah, and you have your gown here, that would be the same thing with the custom pack, but it would also have a tray where you can have saline in it on the back table, because a lot of times when they put the stents, they want to dunk them in water and something, make them slick so they can slide up. And like when it comes to stents, you really don't know who that person's gonna, because it has to deal with their height. All that stuff. That's why you really, there's certain things, you're gonna want, make sure you have this and a balloon. Y'all do balloon dilations when they're having to dilate up there? Okay, that's good.
Yeah.
So I'm just saying they're just doing real easy in and out.
Yeah.
Well, sometimes when you have to do the balloon dilation, you have to scrub in, give, just basically just dials up like like a big syringe, and it opens up the ureter so they can pass that stone, or get a basket up there to pull it out. Since you're doing lithotripsy, that helps like break it up, which, like I said, they're gonna probably come in here first before they can get into the OR downstairs. So I see you have most of your supplies over here, your instrumentation, and just looking here, like if I have a male, elder gentleman, I'm gonna open the dilators. Because I have a pretty good chance they might have a stricture going on. But not necessarily in all cases, you can see on the schedule, and you can anticipate.
Is there a difference for males and females?
Yeah, usually male, they have to have that little
Curve.
curve, so they can kind of, sometimes they have to dilate, they have to go almost like they're almost heading for the prostate.
And the,
Most of the time when they have requested it, it's one specific doctor, and it's generally for females.
Oh,
So we have had to
my,
use
okay,
them.
yeah, usually,
So I was wondering, is there a different
usually
set
we
of
have
dilators
straight
that we have to
for
have?
ladies, they have like straight ones, but, those
I
have
couldn't
become
find
as rare
any.
as hen's teeth, yeah.
Yeah.
We couldn't find them. I got them the wrong one, the males.
Well, we probably know in advance, like beforehand, if they're gonna need those.
Right.
No.
Okay.
When I've needed them, at the moment, he says, I need a pair of dilators.
Yeah.
It's been twice or 3 times.
Yeah.
And I'll
elderly
do like
lady,
D-gown,
usually-
it's a male doctor.
No,
Oh,
I'm
an
talking about the
older
patient,
female, yes.
older female.
And then you're having to D-gown, run over there, try to figure where they are, and then by the time you get them, you get the wrong ones.
Yeah.
So-
Actually, so I go just have those in a room on a hold, but you're gonna have to take a camera, because y'all have all striker and up here. Is it okay to open all this?
Yes.
All right, okay. Making sure that you have all your little pieces here together.
an issue that they've been having, Lori,
Pardon?
an issue that they have a lot of times is the graspers for the flexible ureteroscope.
Yeah, a lot of the flexible ureteroscope graspers and stuff, they have to be disposable. Have you noticed? Or are you talking about this rigid?
No,
We're talking about for the cysto, the flexible scope, we've had
Flexi-
issues. We had some, weren't they bought for the unit?
They
and
were.
then
The lengthwise,
They're smaller in diameter.
Yes, they're
and
gonna be like
longer.
they're gonna be a very small, to make
Yeah.
the channel the flexible scope.
And I don't know, like when we send them, down to be processed, if maybe they just get packaged somewhere else, but usually they're in the peel packs, so.
Okay.
I did
But-
see them.
So we have, did she order some more? Cause we had
we
some
should have
missing.
4.
I saw 3. One was kind of short and then 2 longer ones.
Okay, one of them we thought was our regular one, and I had a case, and it was, because I guess just eyeballing it, you don't realize, and then when they got in there, I was like, that's not gonna fit in that scope. It was more for the rigid.
Okay, for the rigid here, which we have right here. So, got your little custard cup. And this right here, just so you know, this is like a working bridge element. Actually, this was used a lot with lasers.
that's that piece that we were looking at, remember? It's the
okay.
forked one, and I said a lot of times they thread a laser
Yeah.
cable through there.
This one, too. Okay, but I'm just looking at what you have here. You've got a 21, 25, and usually a 22. And that's the green, and it's really faded. So I'm gonna grab this, kind of, right off the bat. That's kind of like standard. And, whether they want a double or single, it's just, I'm gonna grab a double. That's just me. And if you're gonna have a male, so you have the green to green.
Oh, I didn't
Olympus,
even know that.
Olympus makes things nicely coated. And make sure this is all nice and working. So, now these little knobs, not the knobs, so I'm just gonna have that laid right out there for them. They have it, they've got an obturator, it's nice, it's nothing sharp, they can smooth, put that right through. And like I said, 22 is a pretty good standard. If you've got somebody like little grandma coming through, and she's you know, got a lot of strictures, she's gonna probably be, you know, so you can go for something small. That's why you probably go for dilators. So, your light guide cable.
And actually, that cable we don't ever use, I guess,
You
because
just-
we have our,
you have yours
light
Yes, it
sources
goes in
Yep,
right there.
that's fine. And that's fine, with how it gets you. Just to let you know that these are, especially, see how that is like that? If you ever get this light guide cable and you can't get it on here, take that off.
Oh.
Or you can slice onto that, just like that, like that. So let me put
So
this
that light cable is actually only for the ridge and scope, is that right?
Right.
Okay.
Right, and it just has a special snap. Now, some of the Olympus makes, because that's, you know, they've been around for a really long time when it comes to urology. They actually have, see this piece is missing, this has got to be a 12 degree. So that's that. Let's see what you got here. It's like a 70, okay, probably. 70, not so much. I would use that if I was doing a sling, majority when they want to look at the top of the bladder dome after they poked a trocar tube to lift up.
What
So-
about if they're doing a specimen, like if the patient has, if they have
A
bladder
biopsy?
polyps or a biopsy, yes?
Not too much on the 70. 70 is more like of a I've used it most of the time. This is the long one. This is a long one. Sure this doesn't go to your flexible?
Yeah.
That's what I'm saying, that's,
Yeah.
yeah.
Generally, that comes packaged separate.
Okay,
Peel
well, we will
back,
peel that
yeah.
back and do that. and-
Yeah.
Yeah, that's
That's where
definitely
we
the
can't
situation.
find them, because generally we have them
They're always
separate, so.
hidden in plain sight, yeah, I know. It does happen, you know, I know that they try not to, but it doesn't, they get in a hurry.
That's
So
probably
we're
where
glad
it
that we found that. Hey, but make sure you have your little Christmas tree, and that's one thing, if you have that pack, you'll have the KY there, and you can just dip a little bit, just put just a little bit on there, and it'll stick really good onto your tubing. Let's see what we got in here. Do we have our oh yay, gotta have these bad boys. These little rubber stoppers. So when they're putting things in, they don't get squirt back on them. So you've got these all put together, nice.
See, I don't even know what that is.
So when they introduce,
Let me see that, hold it still for
Mhm.
me. Okay, so the little black rubber stoppers,
They sit right on top of that.
and they keep it from splashing up?
A backflow.
Okay.
So you're gonna introduce either your catheter or an instrument, it's just gonna keep a seal so they're not, that.
Oh, but it goes through the rubber stopper,
Yes, it
though,
does.
right?
It's got a little
Okay.
tiny perforation right there. You can just do both of them up if you want. Only thing with, you know, some guys wanna, if they want a bigger lumen, but, you know, that's, you know.
And those are
you're here.
disposable, right?
They can be disposable. I throw them back in the list and see how
Okay.
they go, you know. Just make sure that you have them the next time. So let's do this back in.
Do we
here.
keep some separately pill
Yeah,
packed?
they have some down, they might have some down peel pack. There's
Okay.
also a new generation, it's kind of blue and flat,
Okay.
but they do the exact same thing. So we're gonna put our big old long grasper over here and save it for our flexible cysto. And this is a 12 degree. As a whole, I'm gonna go with a 30. Have that out for the doctor, I'm just gonna lay it this way. Since this is missing that,
Can you show them where the degree is so people know? I know, I've seen it, but
I don't,
I open
yeah.
it myself, but can you show it,
Sure.
indicate where they can find?
where the degrees are,
Correct.
right here, at the head. Right there's 12
That way you can
degree.
record.
Okay.
Okay,
Let me see my dry cubicles. Video. So, I'm gonna usually stick this in kind of an opposite direction. That's just me. And here's your 30 degree. It's a little faded, but I'm also look at the tip. See how it's a little bit of an angle? There. Just very, very subtle.
Uh-huh.
I just know that's a 30 degree, unfortunately. And, you know, when the guys come here and do some maintenance, you can ask them to re-ink that. They come here and laugh. Hopefully this isn't sitting on top of it. And then you can look at the 12 degree. You can tell almost how it almost looks flat. It's just almost like a zero, like a flat line. But just look at it about that. Nice. So I'm going to lay those two out there so they have both of them. But 99.9% those guys are going to grab for 30. Just right up there. So let's say they're going to grab your, this is a grasper, and it's got a little flexible to it. It's got little ridges here. And if they become loose or whatever, they might be tightened back here. There's a little collar right there. You can kind of tighten it up, and sometimes they come loose just because they have the process that way. But they're going to take that bad boy. So once they've introduced this, they've got fluid under here, come out here. The doctor's probably already taken this and put that together just like that. So he's going to leave that in the urethra or the hoo-ha. And you're going to slide that back in there, lock it in, turn it that way, and then you're ready to go. He's going to probably have these turned down so he's going to see. So he's going to get ready. So when he's ready to get pull his stent out.
And those are your working ports right
This is
there.
your working ports right here. That's going to slide right in that little buttonhole just like that. It's going to go right in there. It's going to go all the way down through, and he's going to shove it in there. Right in there.
That's some good medical terminology.
Yeah,
That's
that's
what they
it.
do.
He's going to shove that. Get pull that stent, whack it, pull. They'll usually pull kind of
The
both
wood
together.
things.
Yeah, yeah. To get that out, because you're going to be doing that and adjusting that. So that's a nice little cup grasper. Let's see what else you have here. They're both the same. I just want to make sure. So that's good, because you're not, you know, and this one, oh, it's got a little tooth on it, so that's, you can see a little tiny little teeth on there. They're very, very, just very subtle. I would give him that first to grab a stent because it's got a little tread on it.
Okay.
So he could grab and pull that out because that's what you've been doing. But if
That's
you
going to
won't,
let him grip it
it's
better
gonna
with
let
the
him grip.
teeth.
You see very subtle. I mean, it's like,
Does it have any indicators on the handle itself to see which one?
no,
No,
no.
you just have to see it.
The old eyeball, I know. And I know, so I have to trombone on that. Well, this one is more like a little cut forceps. And actually, they could probably do biopsies with this. Let's say they say, that looks kind of funny. I'm going to pluck that out and send it, you know. But it's a little cut. Good there. So you're good with that.
Yeah.
So dealing with this, one thing about Olympus, they do have a light guide cable that has a special, kind of like an extra like lens on there. So you don't have a chance of burning the drape. These guys unsnap and let that thing hang. You can get a hole in your drape just like that. Even though it's wet, and that's better, but it can happen. So just a little FYI, you know that's out there. That could be. And you have your nice little camera head here all ready to go. Squeaks just like ours. Rite of passage. So anybody have any questions about the video system? Because did they ever take pictures down here? Or they just
They
say
do
that
do live.
Yeah, they just do it live, but they don't take
video.
a picture, yeah.
Yeah, a lot of them have gotten away from that. I know there's one occasional eyeball it.
If they do take pictures, can you show us how I'm assuming we're the ones that have to print it or set
Well, they
it.
need to tell you that before they're going to take pictures
Because
to
you have
tee
to
it.
have the
You have to input it
tower
into
in
the
here.
tower and put it in
Okay,
there
good.
and have the
So
printer.
that narrows it down.
Yeah,
You can tell.
yeah. I didn't know if you didn't. Yeah, I mean, honestly. So
Has he ever have you ever had to take
But
pictures?
you never
or-
know, there's always odd things that people want at
Mhm.
different things. So.
right,
Like,
exactly.
we had to use
I
the
would-
basket before,
Mm-hmm.
so
If-
it's like we never had to use it in one time.
Yeah.
One doctor wanted to use the basket and we had to go, we didn't have it, now we do, but things like that, it happens, so it's good for us to know.
Yeah.
Exactly, exactly. And looking at this is more of a little grasper than, you can see you can see the treads better on that one actually.
Mhm.
Can you see it there? Oh, hello, Sylvia, sorry.
Okay.
There you go. That's gonna be through your flexible ureteroscope. Anything about the rigid here, any questions?
When do we use a rigid as opposed to a flexible?
Yeah.
Okay, when I have like a cysto exchange, putting a stent in, I'm gonna go with the rigid off the bat. Anytime in the operating room, if it's some type of kidney stone, then I know I'm gonna need to have the flexible ureteroscope. But do y'all have ureteroscope, or this is
We
just
just have
flexible?
a cysto. Yeah, we just have a
Flexible
cysto.
cysto. Most of the people who are coming to the operating room and they're having general anesthesia or IV sedation down there, not so much with the flexible cysto if we're down in that setting. Most of the flexible cystos that I'm working with physicians have been office-based.
Yeah.
Because they want to comfort, there may be something that they
I
don't want to.
think sometimes what happens here is because they know they're coming in for a litho anyway, and
Mhm.
they're like, oh, well, rather than come here and then go to the office, they just
Right,
do it all.
they just do it all for them. So I'm just going to lay this back on here. And of course, you got your scissors to cut your little strings, and do they take it during the little
What is,
strings?
they don't use the strings. I mean,
Okay.
I always
Some of
see
them
them
take
cut
them
them
off.
off.
They
Yeah.
cut them off,
Some do.
okay? They just kind of cut the thing there. Some of
There's
them
only one
like
marker
it,
that leaves the string.
Yeah.
leaves the strings, and they put a little tegaderm to secure it to the inside of the
Yeah.
legs, so
Yeah.
It's only one.
they have that. So since we have your lovely thing over here, let's see what you have here in your system. Any questions or anything I need to slow down on, or?
On, you know, when you can, when you open up the, is that the set or is that the flexible there?
This is the flexible I'm getting ready to open right now.
I guess,
I think in the video, the one thing that would help if you put it all together, like connect the light, connect the light source, connect where the fluids would go, so people know how to put it together.
yeah.
Okay.
And then you
Yeah.
can watch that as it.
Mhm.
you
Because
know.
like with the rigid, I have a hard time knowing what piece goes where.
Do y'all have a light source in the room she could use?
We can go get one.
Okay.
But you can connect it to the.
Just to the cord.
To the
Oh,
cord.
okay.
We know the other part, we can
Thank
fix it a little bit better, but I think just people seeing that
Okay.
probably would help a lot with somebody that has never done it.
Okay.
I think that's just for processing, right?
Right, it's for processing to keep it from blowing up at the end here,
Yeah.
because it would happen, it would just, the pressure of it makes it explode. And you usually would have some type of sure seal on here, it's a little disposable seal that you put onto here.
Okay.
You know,
Would,
never mind, I looked under the math, if they don't have that, this is what you'd use, it's just,
Okay.
it's disposable.
It's,
That's all.
okay.
Does it come, is it under the urology part where you'll
Separate.
find that? It's
Yes,
called
and
Sure Seal?
A sure seal. And this one, where you have your fluid, is all coming through in here, plus
Is that the working port right there?
You're right
That's the one
here.
you use?
That's
Okay.
right there, that's where it's gonna
Okay.
go through. Right on down.
And then your water's gonna attach
It's gonna
to
come
that.
right to here too.
Okay, that's easy enough,
Mhm.
because that reminds me of an endoscope, and I'm familiar with
Mhm.
them,
Yep,
so.
there you go.
Okay, that's pretty easy.
Usually, sometimes the guys, they have a tendency they wanna put their eye on that, cause it's just so close.
Yeah.
They, they don't always use the, they don't always use the camera.
Most of them do.
Yeah, most of the time they don't with that, I know.
That's right under there,
Perfect.
just like that.
And give
And
them
your
the
tea.
fluid.
I put a bag of fluids right there.
No, just,
Since you got a stock talk on here already, yeah, thank you.
We'll just do this, that way people know how to put it together.
Right, exactly.
So you grab the
I'm gonna stick
cysto
this right
tubing.
here.
Okay.
Go right back to
Awesome.
Sure. My hands, yeah.
We're pretending this is sterile.
Well, since this one's kind of already has like a little place, you can just kind of cinch that right onto that. Without having to worry about having
Perfect.
it.
That's what we use.
Just, it is, for this, yeah. Makes it very, very simple for that. Whereas. the
Does that
other-
need to stay on while you're doing,
This, you can go either way.
Okay.
I would just leave it on just so you don't lose it.
Okay. Okay.
It's all been through the process and everything, so, that way you don't have to worry about it. Unless they went, what is this?
Yeah.
The doctor, Yeah, I think of one that would probably not want that though. So,
You always have to have a few.
a few, of course, what is this? Yes,
We're just checking, seeing if you're paying attention.
Exactly, just seeing if you're paying attention. So, but yeah, most of your, you know, your flexible, it's just gonna be most of your, he's gonna do a quick peek. So let me go back over here and do that again for you. So, no problem. And, put our little graspers out here. So, I would have my KY do a little dab of do ya right on that. Let's stick this in here, because as you can see, if I had this, that's make-believe KY for everyone, yeah. If you can see, if you ever might.
So that's your adapter piece?
Yes, my little adapter. This is a
Okay.
little Christmas tree. They'll call it a Christmas tree sometimes. It has a little lever. And I just, on
Those
the,
are the ones we
yeah.
always end up with.
And remind
Be so
them that we
careful
need to
take
get
that out.
Unscrew that one before.
Because it will get thrown
it
away.
will. If
in a
anything's going to throw
heartbeat.
away, it's going to, that's why they always have tons of these.
Yes.
So, put this back in here, just like we were doing a procedure. Maybe, there we go.
Sometimes also, as the circulator in the OR, or whoever's getting the, you know, the drapes and everything pulled off at the end of the case, just make it part of the routine that when you gather up the tubing, that you check that tip. Because sometimes, you know, whoever's handing the doctor things, they forget that piece too. So if you have two people double checking,
Do y'all usually have two people in the room, or is it just one nurse?
Usually it's just one.
okay, so just don't forget then.
Sometimes it's-
That's why it's, you know, a little different, because here you don't have, you know, you're doing both, so.
Yes.
So I have that, you know, open there, and I'm going to pass this off. So he's ready to go. Put this on my 30 degree. And usually the doctors pick that out. But you know, you're all ready, teed up for them to go. Lock that in. Then a little camera here. Go onto that, just like that. That couple it right onto that, and then you're ready to go. That goes one. Either you use your light guide cable and your everything goes to one side. That's much easier on the circulator, unless you have to go bing bong into both sides. And you have your fluid, and things are ready to go.
Okay.
Okay.
I have a question. So when you're doing a litho cysto procedure, is there any supplies that you would recommend that the nurse have in the room but don't open it, just have it in there for common things the doctor may want to use? That way they're not having to go in and out of the room, having
Right.
to run for things.
Like disposables,
Yes.
I would definitely have some type of stent maybe do y'all have any disposable baskets up here too?
I
To
don't
grab
know, we have a
anything?
disposable.
We do have, but there's not that many of them, and I think we've only seen them used once.
Yeah.
So there's
That
the
would be-
helical and then there's the, what's the other one?
Are you talking about the
Are you talking about the
conical
Yeah.
cone
basket,
and there's different like little whistle tips, you know, that I might, just in case if they're doing that and they decide that they want to flush out, they can get, it's broken up in the kidney and it's coming down the urethra, just kind of get those particles
Pieces out.
Yeah, that would be one thing, you know, usually the cysto will give a good flush.
Okay.
They've gotten it down. But there could always be that one thing they might want to, oh, it's just sitting there, I could just grab it, you know. That would be one thing, just some type of stent or some type of basket, they might be able to pluck it out of there with. They might see just a little part, you know, a little piece left.
Yeah.
Because it does break it up pretty good, but, you know,
Yeah.
if they can get them out, get most of it out, they try.
Okay. Anything else disposable?
That, you know, since y'all are not doing that more invasive, like I was talking about the balloon dilations and stuff like that,
Okay.
that would have to be, you know, they may not do that.
Putting it in a dry cup and not in the fluid
The
or,
green, what is that?
Yeah.
Green, what is that called, that solution?
it's a green solution in the cups that sometimes they'll put tissue in from the bladder. But with any kind of kidney stone, make sure it's in a dry cup because
Formalin?
Formalin will dissolve
Eat it.
it. So just make sure it's in a dry cup.
Yeah.
Because my first year of nursing, I did that, and I was,
I think that's kind of the rite of passage.
yeah, the doctor was not real happy with me, let's just say that.
Little pieces and
Yeah.
specimen.
Let us dissolve it for you.
We'll find out the chemical compound.
Yeah, can't you see it?
Any other questions I can help you with or clarify or? None of it's just putting your hands together.